The signs of labour. How would you know you're going into labour? Towards the end of pregnancy, you may experience Braxton Hicks. This is where your tummy feels tight and taut, or I like to call them pre-labour warm-ups. It's your uterus practicing for the day you go into labour. These are usually irregular and there's no pattern to them, and they last about 2 minutes and then they ease off. Sometimes it can mean that maybe you just need, that you're a little bit dehydrated, maybe just drink some more water in the evening, or maybe you've overdone it. But Braxton Hicks or pre-labour warm-ups is perfectly natural towards the end of pregnancy. So how would you know you're going into labour? What would be different? If I was to ask you in a class, people would be saying contractions, pains, water's breaking, the show, the mucus show, the plug of mucus, and the dilatation of the cervix. So what does all that mean? So let's just take a look at the picture. So we're all on the one page. So inside we have a picture here, and inside in the picture it shows the uterus. Here is your lovely baby growing. Your placenta is attached to your uterine wall. Coming from the placenta are the two sacs known as the amnion and the chorion. That's nice to know information, not a need to know. Inside in the uterus is the lovely warm amniotic fluid that's surrounding your baby. Coming from the placenta is the cord going into your baby's umbilicus, or your baby's belly button. There's 2 arteries and 1 vein. Here you have your spine. The last 5 bones that we spoke about earlier is the coccyx. You have your bladder here. So you can see when baby's head moves down into the pelvis that's causing pressure on your bladder towards the end of pregnancy as well. But that's just nature's way of waking you up in the night time to prepare for meeting and feeding your baby at night. Nature is truly wonderful, it's tapping into it. We have the vagina, and inside the vagina, the opening of the uterus is known as the cervix. And the cervix is like a little kind of funnel. Then we have your back passage. So what do we mean by a contraction? Let's look at a contraction first. So if we consider the uterus, and excuse my drawing now before I start. The uterus has 3 layers. The outer layer are the longitudinal muscles, and they wrap around the uterus. The inner layer is interwoven with blood vessels. And then the inner layer are the more circular, that's the middle layer. The inner layer are more circular muscles. And you can see there's more circular muscles towards the bottom. So what happens? The longitudinal muscles push down, and at the same time, they draw up the circular muscles. So if we take my sleeve, and my fist is going to be the baby's head, okay, we have the cervix. So what's happening? The longitudinal muscles are pushing baby down, and at the same time, the cervix is thinning and shortening before it starts opening, before your baby can be born. So the longitudinal muscles are pushing baby down, and at the same time the cervix, which is tightly closed with your first baby, has to thin and open. And in the medical terms we talk in centimetres, and it has to open up to about 10 centimetres, but I prefer to use the term it has to thin and open, a bit like flower in spring or summertime. So if you imagine a flower is closed, and imagining the opening process, it takes time. So what can you do to help? So let's just talk about the signs of labour. The waters don't break. The waters may release around the baby's head. And when we're talking about the signs of labour, the normal birthing or the normal time is between 38 weeks and your 42 weeks. Anything before, you make your way into the hospital because that is premature birth. So the waters may release like a gush. There's no mistaking my waters of release. That may or may not be accompanied by the contractions. The water should be a clear colour, any other colour but clear, and you make your way into the hospital. Sometimes the waters might be a little trickle and you're unsure, so your panties feel wet. I always say to the women, take off the panties, just smell. Urine smells, amniotic fluid doesn't. Put on clean panties and a sanitary towel and really just leave the pad. If it's the waters of release, the pad will feel wet. If in doubt, always check it out. What is the show? The show is a plug of mucus, and it's a little bit like kind of jelly on your panties. It's just a plug of mucus with a tiny streak of blood. It doesn't mean to say that you've gone into labour, it just means things are happening. You may not even see a show until just before you give birth. So let's just recap. The contractions. They may start, they may be irregular, they may be short acting, they might last 10, 15 seconds. You might get 3 or 4 in an hour. Or they may start and they may be more regular. So basically what we're looking for is regular uterine contractions. You may feel like a sharp period-like pain along your nipple line, or for some women they may feel it more in their back. So it's regular uterine contractions, they're coming closer together and lasting that bit longer.